Thank you, John, and thank you, Eric. And it's lovely to see everybody. It's great to be here. These are things very close to my heart for many, many years. Here's the question I'm going to ask. Why on earth should the state be involved in social care funding for the whole population? So Eric extremely helpfully teed this up. The UK is an example of a nation where for most of the population, they are on their own. Once you have wealth in the UK of in excess of about $30,000, including the value of your house, you have to pay for your long-term care yourself. The way I try and think about this is, so here is the data set that I've sweated more over in my life than any other. So this is the probability distribution of social care costs in the UK. So imagine that we took 100 65-year-olds and we lined them up in order of how much social care they need. This is the shape that it has. You see, so roughly 1/5 of the population of the UK won't need any social care. They'll be climbing up Mount Snowdon at the age of 90 in full health. They'll have a heart attack. They'll die immediately. They'll never need any social care. But it's only 1/5 of the population that is that lucky. The other 80% of the population is going to need long-term care, which means needing it that badly that you pass the pretty rigorous local authority assessment. So these are people who genuinely need it. You can see that the shape of this curve is characteristic. So in the middle, if you're the median person that your social care need, well, I've deliberately left the y-axis off, but the median person, it's about £20,000 worth of social care need, about 30,000 US dollars, the equivalent of maybe 6 months in residential care. So the median person, it's not a huge sum, but then you have this highly skewed distribution. And in the tail of the distribution, the need could be many hundreds of thousands of pounds. So one possibility is you end up with early onset but slow dementia. Another is that your arthritis gets so bad that you can't boil a kettle for yourself or wipe your own bottom. And in those circumstances, you could end up being in residential care for 10 years. And if that happens to two of you, the demands could easily be north of £1 million. Now, we can all see this is a very characteristic shape. This is not the shape that most consumption items require. This is the shape that is crying out for risk pooling. So faced by this kind of probability distribution, which we see in needs for long-term care, we see, as Eric has described, in needs for medical expenses late in life. We see it in the consequences of car crashes or houses burning down. Or faced by this, what we want to do is we want to pool the risk. And as is often the case, and is particularly apposite to point out in the current UK political circumstance, Winston Churchill got here before the rest of us. So Churchill, who was heavily involved in the introduction of labour exchanges in 1908, on which he worked with William Beveridge, coined a wonderful description in 1908. He said, social insurance brings the magic of averages to the rescue of the millions. And this was the point he was making, that in unemployment, in old age, in sickness, the probability that any one person will be in the tail of the distribution facing catastrophic costs is not high. And so we need an averaging, we need a risk pooling, we need some kind of insurance mechanism. It's clear that long-term care falls into this category. It's unbelievably stupid, although often suggested in countries around the world, to get people to save for their long-term care needs. The average person in the UK will need £20,000 of long-term care. The person in the tail of the distribution could easily need £1 million of long-term care. Ex ante, we don't know which shall be. Does it make sense to tell everybody to save £1 million in case they need long-term care? Of course not. Much better to get everybody to deliver £20,000 and be covered in that way. So it's clearly an insurance problem. Why isn't it dealt with by the private insurance market? We don't have state intervention in house insurance or car insurance, except for regulation, and in the case of car insurance, making it compulsory. Why on earth does the state need to be involved in this? Why can't we just leave it to the private sector? Why is it the case that in the UK and the US, there is no effective private insurance market? Well, it's very simple. It's there are many problems to the insurance market. There are some adverse selection and moral hazard problems, but the big problem to the insurance market here is the impact of aggregate shock. So if for the private insurance industry to deliver insurance in this area, they've got to be pretty confident that the probability of an aggregate shock is low. And actually, we know the probability of an aggregate shock in this area is actually quite high. There have been some attempts to deliver private insurance in this area. Most of the people who've tried to deliver that have subsequently gone bankrupt because there has been aggregate shock. In effect, the shape of this curve has moved upwards to the left. And if you're covering the catastrophic cost as a private insurer, then at that point you go bankrupt. It shouldn't be a surprise to us that the private insurance industry is not willing to play here. The private insurance industry delivers private health insurance because you go to a private insurer and say, I'd like a premium for you to cover me for my health costs next year. If you were to go to your private health insurer and say, I'd like you to give me a premium that covers my health insurance with certainty, my health costs 40 years from now, your health insurer, I hope she would laugh at you because there's just too much uncertainty. That's exactly where we are with long-term care. So we're not going to get the private industry, private insurance industry delivering a good product here. So what can we do? Well, we can go down the NHS model. And as Eric described, there are some countries in the world that have done that. So the state just takes the whole risk. We pull the risk entirely through the state. That's a perfectly feasible thing to do. It's quite expensive if you're not doing it already. And it almost certainly leads to a significant increase in demand. We've gone part of the way in this direction in Scotland, where the first part of long-term care costs are now provided free from the state. And when we did that, we did indeed see very significant increase in demand. So if we're not going to go down this road, and that's not a road that I think many countries that haven't already gone down it are likely to go down, the interesting question for economists is, if the state's not going to take all of the risk, which bit of the risk should it take to maximize efficiency and to maximize welfare? And some of you will know that I've argued very strongly that the answer to that question is, if the state's going to take part of the risk, it should take the catastrophic part. So we should have, if we're not going to have complete social insurance, we should have social insurance with an excess. That is, we should leave individuals and their households with the liability for the first part of the risk, the green part of the risk on this diagram, but the state should step in to take the catastrophic element. The intuition behind that is that at the moment, buying social care is a bit like being in a shop with no prices, because although you know how much it will cost to have your own care or your partner's care or your mother's or father's care each week or month, you don't know how many weeks or months it will go on for. So you don't actually, in any interesting way, know the price. You know the price per period, but not the total price that you will pay. Faced by that, all except the very most wealthy will seek to constrain their demand to as cheap as possible that meets the regulations. That's extremely distressing for the individuals concerned. Funnily enough, it's also extremely distressing for people who are providers in this market, because it means that there's very little scope for producer surplus, for returns to innovation or investment. So that's your intuition behind, if you're going to take part of the risk, taking the catastrophic risk. For an analytic solution, there's Ken Arrow's lovely 1962 AER paper, which demonstrates analytically that if you're going to insure part, but not all of a risk, the part of the risk that you should optimally insure is the catastrophic element. So my own answer to the question, why should the state be involved in long-term care provision for the whole population rather than just those who have very little income or wealth, is that there is a massive market failure in the shape of a missing private insurance market. it's very hard to see the private insurance industry delivering that. The right way to tackle this is for the state to come in, remove the catastrophic risk through social insurance with an excess, which people should certainly be expected to pay for. And that if we do that, we both remove the fear of catastrophic consequences facing individuals, which should lead to a freeing up of precautionary saving that is being inappropriate, and we make it feasible for the market in provision to be more innovative, to see proper investment and return, and so we should win every way round. That's all I should say. Thank you very much.